I would be really surprised that this video does not get censored. But we're going to talk about a conversation I had with a acquaintance of mine. So I hadn't seen this gentleman in a long time. Comes in and we chat a little bit, and I go, "How you been? How you been lately? What's been happening? What you been up to? That kind of thing." And make sure my computer's on mute here real quick. So he's like, "Well, it was kind of unique." He's like, "Well, just buried the mother-in-law." I was like, "Wait, what?" And he's like, "Yeah, we had her funeral. We finally got to bury her last week." I'm like, "Finally? What do you mean if I finally got to bury her?" He goes, "Yeah, we weren't allowed to bury the body after she died from cancer back in, I think it was like January, February." I'm like, "Oh wow, why weren't you able to bury the body?" He says, because on her death certificate it said COVID-19. It said coronavirus was the cause of death. And they're like, she's been battling cancer and losing the battle throughout the last year, and finally died early this year from cancer. And the doctors decided they would label her death as a coronavirus death. So doctors lied. So they took them to court. They requested, simply reverse the cause of death, and they wouldn't. So they had to take the doctors and hospital to court to get it reversed. Now think about this. You think the coronavirus numbers are real? The numbers of coronavirus deaths are not real. All right. There are people dying of a virus, of infectious diseases. I'm not saying they're not, but the actual numbers they're giving the public and driving fear with are not real. Now, that doesn't mean people aren't succumbing to pneumonia. That doesn't mean that people aren't sick in the hospital. That doesn't mean that there's not an infectious illness spreading around, going around, that can be the last straw that takes somebody's life. But what is wrong is the lies to gain money, to gain the power, through the force and fear that they're using. That is wrong. Our nation, our society, our world doesn't deserve this. That family didn't deserve for their mother to be labeled coronavirus death for their dang statistics. Now, if we asked maybe through March, through April, or I forget exact months, but we had roughly a 5% increase in our average annual mortality throughout those months, 5%. But we've already back down to our average. And many countries like Sweden saw a spike. They saw an increase in the number of people dying from pneumonia, and infectious illness, coronavirus, throughout several months. But actually now they're lower than average mortality rates. Because an infectious disease, when it sweeps through a nation, through a population, it does spike the number of people that are in that susceptible arena, in that group. It spikes them, and it can cause them to die a few weeks to a few months sooner than they would if that infectious illness wasn't as harsh as what it can be. But do you guys get this? The medical community thinks it's okay to put coronavirus on their death certificate so they can get a bunch of money, but yet that, while this cancer patient, maybe it was some sort of pneumonia that caused it. And it's extremely common for cancer patients to die from pneumonia. And there's viral pneumonia, bacterial pneumonia, and there's pneumonia without any pathogenic organism identified that is a common cause of pneumonia. So can you blame the hospital for wanting a little bit extra money? Maybe some of you wouldn't. But what those statistics are being used to do in this nation is wrong. It is a lie. It is a sin. It is evil what is happening in our nation right now. It is creating anger, frustration, hatred, physical violence, all kinds of things, negative things. I mean, I had a young mother today come in talking about how they've been dealing with their son's mental health here over the last several months. He loves school. He is heartbroken that he has to go back to school with a mask on. He was heartbroken that they shut down school, and he dealt with serious depression. Not okay. The number one cause of death in our children, one of the number one causes of death is suicide. In our young children, 10 to 14 years old, under 18. And we're increasing one of the number one causes of death for something that almost has it's a 0.0000000, I mean, risk of them dying from. In which if we were allowing them to catch it now while they're kids and have very low mortality and sickness and morbidity rates, they would have memory T cells and immunity, possibly lifelong to some degree, maybe not where they never got a coronavirus again, but they would be benefited by this infection at that age when they're not obese yet. Sadly, a lot of our kids are obese. A lot of our kids have diabetes. A lot of our kids have serious immunological conditions that put them at risk of infectious diseases, triggering it further. But that is a result of our poor care, our horrific medical care in this nation. There was more that could have been done for these people. There's more and better things that could be done than listening to Fauci, than listening to our health authorities who are willing to participate in the sins of others through the deception and lies. Take no part in other man's sins. The fact that they had to go to court for now since, I forget the exact month, January, February, whatever. Earlier this year, at least 4 months, they've been in court just so that the death certificate didn't read coronavirus, because that is unethical. Medical malpractice. That is lies that are being used to control the status of fear in our nation. Unacceptable. Yet again, talking to a father of a nurse in Florida, says they're labeling everybody and anybody they can, whether it's assumed or tested positive. It doesn't matter. If the patient has even one or two of the symptoms, they're labeling it as what? Coronavirus. Anybody and everybody they can. A person comes in with a car accident, has to be put on a ventilator. Oh, they've got pneumonia. Yeah, they had massive bruising and fluid buildup on their lungs. Yeah, now they have pneumonia. From a physical injury, but because it aligns with similar symptoms, it's pneumonia, it's coronavirus in Florida right now. I wish and pray, but guess what? Shoot, there was a politician who's been on Facebook lately saying he had a report to his medical board. He's a politician who talked about the lack of evidence, I think it was, of masks. And because he did that, he was reported to his medical board and they have to investigate him. It'll probably get tossed to the side because it's a junk. He didn't do anything wrong. He was exercising his freedom of speech. But he's been on several times about how ridiculous the medical community is being about masks right now. Take no part. This is where I stand on this. Take no part in another man's sins. I will not continue to live as if it's just simply a virus going around and we have to do all this. I won't allow people to continue to be lied to be deceived, to do the wrong things, or do a worthless thing, such as wear a mask in a situation like this. Holland's government said don't wear masks because it could cause you harm. Dutch health ministry says we won't recommend masks because they don't help in the general population against respiratory illness. In Sweden, they said no, and they've already seen multiple days where there's no deaths. Now we're basically the same number of people dying per million in the US, and we're seeing increases. Is it a virus? I think we got a virus going around. I had a harsh cough over the winter during deer season. Yes, this will be the straw that breaks the camel's back and be the end to somebody. And we're all going to die. We're all going to die someday. But you know what makes the difference? If shielding somebody from catching coronavirus helps them live a few weeks to a few months, you could say that's a good thing if a mask could possibly do that. I disagree that it can. But let's say that it does. What's the value in that versus what people need to hear, need to be told about the things that could actually allow them to live years, tens of years, with a higher quality of life, less pain, less suffering, less total illness, less drug use, all these things. That's what people deserve to be told. And there's no drug and no vaccine that will ever do that. But that's not what our health directors, our health departments, our governors, our mayors are telling people right now and teaching people. My office sits next to a place called the Fat Shack. For God's sakes. It's a line out the door for free samples for the junk they feed these people that causes people to develop obesity much more rapidly. And obesity is one of the number one risk factors. And sugar alone, these fried Twinkies, fried whatever else they're putting in the frying pan, weakens their immunity. Thus, maybe somebody who eats a Fat Shack is the straw that breaks the camel's back, allows them to be susceptible to the coronavirus that's stuck in their mask that they're going to inhale as they wear their mask, because viruses aren't blocked by that material. Or if it is caught, as they continue on wearing it day in, day out, it gets sucked into their lungs. And had they taken the mask off, removed it, they wouldn't have got the respiratory virus. They touched the surface, they touched their mask, they put the virus from the surface onto their hand, onto their mask. They take it off and put it on, take it off, put it on, take it off, like they have to go home and do, or in their car and do. Now they have a respiratory virus because of wearing a mask. And because of junk food still sold in our grocery stores, still sold in these places. And get me, people, I want you to have the freedom to choose what you eat. You can eat Fat Shack. You can eat McDonald's. You can eat Wendy's. You can eat anywhere. You can eat grass. All right? You can eat vegetables. I want you to have the freedom to choose what you want to do with your body, your life. I will fight for that, for you to have that ability. I don't believe in shutting these places down, but I hate the incongruency. I hate the deception. I hate the lies. I hate people's deaths being used to drive fear into this world, into the hearts and minds of people that are good on their inside and want to do good and want to do right and want to help other people reduce the risk of an infection. But because of that fear, they're actually causing harm. They're causing turmoil. They're causing discourse among brethren. One of the things the Lord does hate. And that's wrong. It's a sin. I will take no part in it. And I'll shine light on deception, on evil, on wrongdoing. But to the best of my ability, I'm not going to condemn the greeter at Walmart who tells me I need to wear a mask. I'll talk more about this later. Please don't do that. Love your fellow brothers and sisters. Use the opportunity, if you don't want to wear a mask, to say, can I just talk to you for a second about the mask issue and share with you what the science says? Grab the science off my website, thewilddoc.com. To mask or not to mask. I went through multiple scientific studies, randomized controlled trials on masking. Could actually increase infectious disease spread of respiratory illnesses. Might reduce bacterial, but not respiratory viral illness. could actually increase it. But folks, I got to get going. The lies have got to stop. And they probably won't, though. They probably won't on our own human means, the means of me and you, the fight that me and you and others who want to speak truth and teach people, we probably won't get the lies to stop. Shoot, the word of God can't even get people, and even some Christians, including myself at times, who struggles with sin, to stop doing wrong at all times, all days. But to me, we got to try. We got to try to do right and do good for one another. And when people are doing wrong, when people are lying, we need to speak up. We need to put out their lies. We need to encourage the nurses, the doctors who are seeing this and they know it's wrong to speak out. And we need to be willing maybe to say, you know what? Take your license, and if you get fired from the hospital, you know what? Set up your own private practice and we'll support you. And start putting your money where your mouth is. Start fighting tyranny by never, even if it's your insurance paying for your doctor's visits, if they're not telling people the truth, then don't give another dime or cent, whether it be through your insurance or through your own pocketbook. Stop giving money to people who won't speak up, or the people who are willing to condone and assist in the deception and lies, but yet let you have your freedom. It's good that they let you have your freedom, but if they continue to assist in the deception and lies of others, they're taking part in other man's sins. And I disagree with that. Do what we can. Maybe that's a way to do it. I'll keep trying to get stuff like this out to you. Please share the truth. Don't just like it. It's the way we save lives. Love you all.